Hello everyone, welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for April 18, 2018. Thank you for joining our presentation this month. Our presenter today is Leigha Vilen. She's a senior undergraduate at the Gillings School of Public Health at the University of North Carolina in Chapel Hill. She is our Students Program Manager and Walk with Ease Program Data Manager. She will graduate next month with degrees in Health Policy and Management and Dramatic Arts. Welcome, Leigha.
Great. Thank you, Haley, and thank you, everyone, for being here today. I'll be discussing my undergraduate thesis research, which was an evaluation of implementation and plans for sustainability of the Arthritis Foundation's Walk with Ease program in community organizations that received year-long Walk with Ease expansion grants from the Osteoarthritis Action Alliance. So just to overview where we're going to cover today, I'll start with a brief review of the role of evidence-based programs in managing arthritis. I'll then provide a brief explanation of the program features and the effectiveness evidence for Walk with Ease. I'll review the Walk with Ease expansion mini-grant program, which is currently in its second year here at the OAAA Action Alliance. And then I'll describe the results of my evaluation of Walk with Ease implementation and plans for sustainability with 5 first-year grantees. This evaluation included plans for sustainability that grantees reported, factors affecting implementation and sustainability, and barriers to implementation and the solution that grantees used to surmount those barriers. While there's no cure for arthritis, regular physical activity is a first-line treatment, and it's been shown to improve both pain and function by about 40% among adults with arthritis. Yet, people with arthritis experience substantial barriers to physical activity, including a lack of opportunities designed for those with arthritis, or fear that exercise will exacerbate symptoms. Therefore, in every state, people with arthritis engage in less physical activity than those without arthritis. The barriers to physical activity, though, can be alleviated by offering arthritis-appropriate evidence-based interventions, or AAEBIs, which are research-tested programs that improve outcomes in people with arthritis. The AABIs shown on this slide are all centered around physical activity and are recommended by the CDC Arthritis program. Today's presentation will focus on just one of these, the Arthritis Foundation's Walk with Ease program. Walk with Ease is a 6-week walking program. Its instructor-led form is listed under the CDC Arthritis program recommended program, while the self-directed form is listed as a promising program. Walk with Ease is the least expensive and the easiest to implement of the CDC recommended AAEBIs for a couple of reasons. There's no program license, the cost for the leader training is modest, it's $89, and the training can be taken online. And the program requires no special facility or equipment. It's a walking program, it can be done anywhere. There are also some other benefits of Walk with Ease. It has a self-directed format in addition to the instructor-led format. This could help increase the program's reach to participants who have limited transportation, time, or interest in participating in a group activity. Additionally, both formats center around the Walk with Ease workbook, which you can see on the slide, which is likewise inexpensive for community-based organizations to purchase, and it's easy to order online. In terms of effectiveness, both the instructor-led and the self-directed forms of Walk with Ease have been shown to be effective at improving outcomes for people with arthritis. The original study in 2011 showed that Walk with Ease improved arthritis symptoms like pain, stiffness, and fatigue. It also improved physical function and psychosocial factors like arthritis self-efficacy. A secondary analysis of the original study showed similar effectiveness of Walk with Ease among African American participants, and a study a few years later of the Spanish language version, the Camine con Gusto program, showed similar effectiveness for Latinx participants. Finally, the program has been shown to be feasible and to maintain its effectiveness in a scaled-up trial. In a study at Oregon State University, the program was implemented at 28 different sites, including retirement centers, medical centers, community centers, churches, and workplaces. In this trial, organizations were able to successfully adopt the program, deliver it with good fidelity, and reach people with arthritis in their networks through targeted marketing. So, based on the results of all this research, Walk with Ease is a good candidate for widespread community implementation, which would make it available to more people with arthritis. To that end, The OA Action Alliance's Walk With Ease Expansion Grant Program is part of a 5-year CDC grant designed to identify and implement effective delivery and dissemination models for AAEBIs, including Walk With Ease. The 15 grantees that you see on the slide are the first participants in a 5-year grant initiative to expand Walk With Ease programming into at least 25 states. All of these organizations have had experience delivering evidence-based health promotion programs, and they represent a broad cross-section of organizations in the community. They include area agencies on aging, other organizations that serve seniors, health systems, YMCAs, universities, and community or aquatic centers. Most of these organizations began their grant periods on April 1st, 2017, and ended them on March 30th, 2018. All the grantees were required to offer the instructor-led Walk With Ease program during their grant periods, and 5 also chose to offer the self-directed format. In addition to providing opportunities for people with arthritis to participate in Walk With Ease, another goal of the expansion grant program is to identify effective dissemination and delivery models for Walk With Ease in community organizations. To that end, I'm going to spend the rest of today's webinar discussing an evaluation that I conducted on with 3 goals. To determine grantees' plans to sustain the program after grant funding ends. 2, to identify intervention, community, and organization level factors related to the implementation and sustainability of Walk With Ease. And then 3, to identify major barriers to implementation and sustainability and what solutions grantees had employed to overcome these barriers. I conducted this evaluation with 5 grantees who had begun their grant period on April 1st, 2017. To get a variety of perspectives and experiences with the limited time that I had, I conducted interviews with the 3 organizations who had reached the highest percent of goal participants at the 6-month progress report of the grant. We'll call these early success cases. They're in blue. I also interviewed the 2 organizations who had experienced significant delays or barriers during the first 6 months and hadn't reached any participants in that period. We'll call these early delay cases. They're in yellow. I do want to note that these numbers only reflect the first 6 months of performance in the grant, so they're not necessarily indicative of final reach numbers for any of the grantees. Once we selected these 5 grantees, I conducted 45-minute interviews with program managers between 1 and 4 people at all these organizations during February and early March. So the interviews were conducted about a month before the grant period ended. In structuring the interviews with grantees, I used the Planning for Sustainability framework as a guide. This framework is particularly appropriate for the goal of this evaluation, which was to evaluate implementation with a specific lens toward the organization's plans for sustainability after the grant period ended. The Planning for Sustainability framework posits that sustainability is a factor of the implementation process and the community, program, and intervention context during the implementation period. So it emphasizes the importance of planning for the sustainability period of a program during that program's initial implementation. The framework has 11 total constructs inside 3 broad levels: program level, organization level, and community level, that influence sustainability. I'll return to this framework in a hot second, so hold on, you'll see it again. But first, I want to talk about the grantees' plans for sustainability. When I asked the 5 grantees to rank their likelihood for sustainability, all of them reported that they would either definitely sustain the program or that they hoped to sustain the program. This was compared with the other 2 options of little chance to sustain or no chance to sustain, so these are good things. Both of the early delay organizations were in the hope to sustain category, along with one of the early success cases, while the other 2 early success cases were in the definitely will sustain category. In terms of plans for sustainability, all of the grantees focused on the importance of community partnerships to their ability to offer Walk With Ease long term. However, there was a difference in the level of development that the grantees had already gotten with those partnerships. The definitely will sustain organizations had both already planned and made the necessary connections for those partnerships. They talked about having already initiated conversations or scheduled classes for the post-grant period. While many of the partnerships that the grantees in the Hope to Sustain group talked about were still in the conception or the planning phase. All right, I told you this framework was going to come back. So to discuss factors affecting implementation sustainability, I'm going to return to the Planning for Sustainability framework because the questions that I asked grantees in the evaluation were structured to align with the program, organization, and community-level constructs in this framework. For each type, I'll address differences between hope to sustain and definitely will sustain organizations that emerge. I'll also discuss any differences that emerge between early delay and early success case organizations. At the program level, all the grantees talked about Walk with Ease as evidence-based as an important factor for why they chose to implement the program. The evidence base was also really important to gain buy-in from the organization and from senior leadership at the organization. So the fact that it's effective is very important. Two of the organizations also talked about it being a really easy program to implement. So both those factors were facilitators to implementing Walk with Ease. In terms of barriers, 4 of the 5 organizations mentioned the rigidity of the 3 times per week instructor-led program. The instructor-led program, according to the evidence base, absolutely must be offered 3 times per week for 6 weeks. And those 4 grantees said that that made it difficult to either recruit participants or get volunteer leaders to run the program. Finally, for training program leaders, all of the grantees were required to train instructors as part of their grant, but they used some different strategies to do it. 3 organizations trained only staff at their organization or their partners, but 2 organizations used staff and trained volunteer leaders. All of the organizations that trained volunteers reported some difficulties with doing this in terms of both recruitment and retention. Potential volunteers often lacked long-term commitment to offering Walk with Ease. They maybe didn't want to offer it more than once. They didn't want to work without compensation sometimes, or they were difficult to recruit in the first place. We didn't see any major differences in program-level factors between the EDCs and the ESCs, the delays and the success cases, or between the hope to sustain and the definitely will sustain organizations. At the organization level, prior experience with Walk with Ease and senior leadership support were endorsed by most or all of the organizations as facilitators to implementation. I will say that 4 of the 5 organizations had experience with Walk with Ease, and they all talked about that as something that really helped their organization hit the ground running with this grant. Additionally, every organization endorsed Walk with Ease as a good supplement to other programs that they were offering. As we said earlier when we talked about the OAAA Action Alliance grantees in general, they all had previously offered evidence-based health promotion programs. For example, chronic disease self-management program or diabetes self-management program, and many also offered other non-evidence-based physical activity or walking groups. So Walk with Ease was a good supplement to these programs. It was a good offer for participants who had participated in other programs as well. Walk with Ease supplementing other programs helped the grantees find buy-in for the program among staff, and it also helped them connect with partners who were already working with them on other programs. They could have the people working with them on other programs go to the partner and say, we have this new program that perhaps your target population would be interested in as well. So it's a good partner connection strategy. We did see 2 major differences in organizational factors that both the early delay organizations reported that weren't experienced by any of the early success cases. The first was major organizational changes during the early grant period. One of the delayed cases was experiencing a merger between their organization and another, and the other organization had a lot of senior leadership changes during that early grant period. The second is that the early delay organizations both had early communication difficulties during that early grant period. The communication difficulties were between different departments at their organization, and those contributed to the delays scheduling and delivering Walk with Ease programs. At the community level, community partnerships were the most common implementation sustainability strategy for all the grantees. This is unsurprising because during the initial grant period and even during the grant applications, the OAAA Action Alliance has emphasized the importance of community partnerships. That's something that we were really trying to get our grantees to participate in, and it was the most important implementation sustainability strategy for all grantees. There was a really wide variety of different partners employed by different grantees: senior centers, aging offices, hospitals, clinics, and work sites. And this illustrates the Walk With Ease program's potential appeal and the variability in strategies that community organizations could employ to gain partners. There's not necessarily a one-size-fits-all method when it comes to partners. In terms of the partners' functions, all 5 grantees used partners to market the program to potential participants, so using the partners' target populations to draw in for Walk With Ease. And they also all used partners to provide locations for Walk With Ease. Providing locations was most important for grantees who were implementing the program over a broad geographical area, so they would have a location in a geographically distant area to offer the program. It was also really important for dealing with some of the uncooperative weather that emerged, like winter. Partners that had indoor walking sites were really important for that. 2 of the grantees independently had partner organizations offer Walk With Ease, so the partner organization staff were delivering the program, and the grantee was acting more as a supervisor over that process. We didn't see any differences in community load factors between EDCs and EFCs, and none between the Hope to Sustain and the Definitely Sustain organizations. All right. To jump into barriers, the last part of my evaluation was to create a list of barriers to implementation sustainability and to report solutions that grantees use to overcome those barriers. Each of the barriers listed here were reported by between 2 and 3 grantees. On the good side, all the barriers listed in black also had solutions that grantees used to overcome them. The first, weather and geography, I just discussed that a little bit with partner organizations. The solution to both the large geographic area and the uncooperative weather was partner organizations that could provide a location that could handle that barrier. On the leader side, I discussed this a little bit with the program. There were some difficulties in responsiveness or willingness to teach the program, especially and including without compensations. That's where inabilities to provide incentives comes in. Solutions to that responsiveness and willingness to teach the program included training staff to teach it instead of volunteers, or cross-training volunteers who had been successful teaching other programs for the organization, and then training them to teach Walk With Ease. A couple more barriers. At the organizational level, we saw this earlier in the factors affecting implementation. Those early delay organizations had big structural changes at the organization. They also had other commitments on staff time, sometimes connected with the big structural changes at the organization. And those didn't have any solutions other than just waiting it out. So they contributed to some of the delays that happened in participation rates at those organizations. Administrative approval was a barrier listed by some of the organizations, and they suggested starting early to gain approval, perhaps even before the grant period begins, to get through any necessary approval at the organization level. Participants and partners, there were a couple barriers there. Allowing the program to be taught twice per week versus 3 times per week was a recommendation to help keep older adult participants and volunteer leaders engaged in the program, because one barrier was difficulties encouraging older adults to come to the program 3 times per week. Finally, difficulties engaging partner organizations. The solution to that was early conversations to ensure that there are mutual goals and benefits to offering Walk With Ease with those partners. So I just want to touch on, so most of the barriers to implementation and sustainability had solutions. There were interesting connections between the ones that didn't have solutions and these early delay versus early success cases. Those 2 organizational structural barriers without solutions, the big structural changes and the other commitments on staff times, were only reported by early delay organizations. So those contributed to the organization's delays. Great. So what is the relevance of this evaluation for community organizations implementing Walk With Ease, including future OA Action Alliance grantees? This evaluation was very small scale, but our grantees indicated that they thought Walk With Ease is an effective program that's relatively easy to implement. So that's very promising to hear. Also promising, while they reported barriers to implementation and sustainability, they were able to overcome or had recommendations for feasible solutions to most of those barriers. This list of solutions could be a useful resource for future OA Action Alliance grantees or for other organizations implementing Walk with Ease. Additionally, the reported likelihood of sustainability suggested that developing those clear relationships with partner organizations during the sustainability or during the implementation period while the grant's still in progress can improve the likelihood that the program will be sustained long term. Finally, one future research direction for Walk with Ease that was suggested by most 4 of the 5 grantees was evaluating the program's effectiveness under different conditions. While Walk with Ease is relatively easy to implement, it is fairly rigid in the instructor-led form. You have to do it 3 times per week. And this can be difficult for both instructors and the older adults who are participating. If the program could be evaluated and demonstrated to be effective as a 2 times per week program, or online, or in some hybrid of the instructor-led and self-directed version, this could improve flexibility and allow the grantees to adapt the program as needed to their own context. All right. Thank you so much for your attention. My contact information is on the slide, and I'm happy to take any questions.
Thank you, Leigha. Just a reminder, you can type any questions that you have into the chat box in the bottom right. So starting off, I do have a question to ask Leigha. So what strategies can organizations use to engage community partnerships for a post-grant period?
That's a great question. One strategy is to strengthen existing partnerships. Perhaps organizations are already working with your organization on other programs. If you're an organization like our grantees that are implementing a lot of different evidence-based programs, grantees that I interviewed said that Walk with Ease was a really good supplement to other programs. So emphasizing that Walk with Ease's potential value to the population that your partner organization serves could enhance buy-in and help you engage those community partners. And even for new partners, emphasizing the program's value and potential can help generate sustainable partnerships.
Thank you, Leigha, for answering that question. We do have another question in the chat box. How could the experience of the OA Action Alliance grantees inform other community organizations in deciding whether or not to implement Walk with Ease at their sites?
Great. The OA Action Alliance grantees that I interviewed said that Walk with Ease was a very effective program, that was something that really helped them in convincing their organization to implement the program. And it's also that they also said that it was fairly easy to implement. So those 2 experiences, I think, could provide a lot of confidence for another organization deciding to implement Walk with Ease. In addition, that aspect of it being a supplement to other programs, again, could provide some confidence and encourage organizations to look at whether Walk with Ease is something that their target population could benefit from. Additionally, while it is fairly easy to implement, this evaluation showed that it's not without barriers. However, for the most part, those barriers that our grantees experienced had feasible solutions. Finally, I think that the ability to offer Walk with Ease in both the group and self-directed forms can help make the program work in organizations. Even if right now your organization doesn't have the capacity to implement the instructor-led, there are always options in terms of the self-directed form. So Walk with Ease has flexibility in that sense and can work with almost any organization's time restraints and other constraints that exist at their organization.
Well, thank you, Leigha, for answering those questions for us today. And thank you all for joining us. Tune in next month